Welcome to Baylor Annette C. and Harold C. Simmons Transplant Institute, where liver transplant operations occur on average every other day. Surgeons on the medical staffs at Baylor University Medical Center at Dallas and Baylor Scott and White All Saints Medical Center Fort Worth have performed thousands of liver transplants since 1984 when the transplant program started. You've recently learned you may need a liver transplant, and you have been referred for a liver transplant evaluation. That means you will have a series of medical tests and meetings to decide if you are a good candidate for transplantation. This evaluation usually takes a couple of days. During the evaluation, the healthcare team will plan your treatment and review the financial resources available to you to cover the costs of the operation and follow-up care. The doctors and nurses will talk with you about whether you are willing to follow all medical and social instructions and ultimately your desire and decision to have a liver transplant. We are here to help you make this important decision. As you probably know, the liver performs many important functions, but the liver can be badly damaged by disease or can fail suddenly for unknown reasons. Common causes of liver damage are viral hepatitis, fatty liver disease, alcohol consumption, primary biliary cirrhosis, primary sclerosing cholangitis, and liver cancer. You may have symptoms like fatigue, weakness, loss of appetite, weight loss, and a change in normal sleep patterns. Edema, a swelling in the feet, ankles, legs, or abdomen, a condition called ascites. Encephalopathy, sleepiness and confusion. Bleeding from enlarged veins in the stomach or esophagus called varices. Jaundice, a yellowing of the skin and possibly dark urine and light-colored stools. Medication and other treatments may help control these symptoms, but if your liver cannot work well and symptoms cannot be controlled, your diseased liver must be replaced by a healthy one. That's why a transplant is necessary.
Before transplant, it was so hard for me. It was just a struggle just to get out of bed sometimes.
Liver transplant surgery is an operation that has successfully treated thousands of patients. The purpose of your transplant evaluation at Baylor is to find out if you need a new liver and if a transplant is right for you. Plan on several busy days of appointments for lab work, x-rays, consultations, and educational classes. You must bring a caregiver, such as a friend or family member, to help keep track of appointments and other important details.
I felt it was very organized. There is a next step and you kind of get ushered through the process. And for me, that put me at ease.
You must keep every appointment and arrive on time. If you don't live nearby, you'll need to have a place to stay overnight near the hospital, like at a hotel, with family or friends, or at Twice Blessed House. We'll talk more about that a little later. During evaluation, you meet with your transplant care team. Your pre-transplant coordinator is a nurse and your main contact during the evaluation, and also while you wait for your liver transplant. She will explain the tests and consultations, your responsibilities, the waiting list, and what happens while you wait for a liver transplant. The pre-transplant coordinator is your go-to person for questions or concerns during the evaluation. Other key members of the transplant care team include the hepatologist, a doctor who specializes in liver disease. The hepatologist will help your primary care doctor manage your liver disease while you wait for a transplant. The hepatologist will do a thorough medical exam and help decide if you could be a candidate for a liver transplant. One of the transplant surgeons or nurse practitioners will talk with you about if surgery is right for you and answer questions about the operation. We have a large team of transplant surgeons on our medical staff, and one of them will perform the transplant surgery and manage your care right after the transplant. The role of the Baylor social worker is to find out about the support you will have from family and friends, your employer, and other community resources. Part of your meeting with the social worker will include an interview with your support person. The social worker will also assist you with financial concerns and discuss resources available to you. Some transplant candidates may see one of the Baylor nutrition specialists to help you meet your nutritional needs before and after surgery. They will review your nutrition status, including your weight and muscle mass, typical food choices, and eating habits. You will attend a class where several transplant team members provide information about the transplant process. We've already mentioned the transplant coordinators. They are your personal contacts throughout the transplant process. The pre-transplant coordinator will be available to help you before the surgery. The post-transplant coordinator will help you after surgery. Our transplant financial staff will review the money aspects of liver transplant, including your share of the medical expenses, out-of-pocket costs, the long-term financial obligations, insurance requirements, and financial resources. A post-transplant coordinator will explain what to expect on the day of surgery, the transplant operation, and recovery after surgery. This is the nurse who will likely call you when a matching organ is found. A lot of dedicated and skilled people make up your transplant team, but the most important members of your care team are you, your support person, and your primary care physician. This is especially true while you're waiting for your transplant. After your evaluation, your case will be presented to the selection committee. This panel of social workers, surgeons, hepatologists, and coordinators will review the information gathered during your evaluation and decide as a group if you're a suitable candidate for transplant. Sometimes more tests are needed, and sometimes a candidate needs to get physically stronger or finalize his or her care plan before a final decision is made. The final decision about whether you go onto the liver transplant list is based on the results of the evaluation and the input of your medical team. If the panel decides you're a good candidate, your coordinator will call you. If you're turned down or put on hold, you will be told why. You will also be told what steps, if any, you need to take to be reconsidered for transplant in the future. The selection committee will decide whether to put you on the transplant list, but will not determine your priority on that list. Your spot on the transplant list is based on your MELD score, which can range from 6 to 40. MELD, or Model for End-Stage Liver Disease, reflects how sick you are. The higher your MELD score, the closer you get to the top of the list, and the higher your priority for a transplant. The number you get is based on blood tests, and that score can change for better or worse every week. The important thing to understand is that your MELD score determines your place on the transplant list, and it is not influenced by who you are, what you do, or who you know. As part of the pre-transplant orientation, you will learn about the important option of living donor transplantation.
So you're interested in getting more information about our Living Liver Donor program?
A living donor transplant shortens waiting time and improves the chance for transplant success. Patients who are transplanted earlier recover faster than patients who must wait until they are very sick to receive a transplant. Most organs for transplant come from people who died and chose to donate their organs. In a living donation, a living relative or friend can donate part of his or her own liver for your transplant. A little over half of the liver is taken from a donor and transplanted into a recipient. Potential living liver donors should be healthy, have no major medical or psychosocial issues, be younger than 60, and have a blood type that's compatible to the recipient. The divided, donated liver will grow to its full size and volume in both patients within a few weeks.
Bottom line, there is a score that we use to list patient for a brain dead donor. If your score is not high enough, you're not going to be on top of the list, and you're not going to have any access to the supply of the brain dead donors. At that point, living donors is the solution for your problem.
The Living Donor Liver Transplant program at Baylor is one of the busiest in the nation. For any friends or family members who are interested in being a live liver donor, a confidential online donor application that takes about 15 minutes to fill out is available at livingdonordallas.org. Possible donors will be contacted by a coordinator to answer questions and guide them through the process. There is no way to predict when a donor liver will be available, so the transplant team must be able to reach you at all times. Make sure your transplant coordinators have contact numbers for you, your family members, and any other primary support people. Make sure your voicemail is set up and working. You must let us know of travel plans, especially when you're close to the top of the waiting list. And tell us if there is any change in your insurance coverage. Another important responsibility is to know before your surgery how you will get to Baylor. Sometimes a donated organ must be assigned very quickly. The faster you can be reached and get to the hospital, the better. You must not be more than a 6-hour car ride from Baylor. It is very important to know how you will get to us and who will bring you. While you wait, your hepatologist will work closely with your local doctors to keep you as healthy as possible and get results of your routine blood tests. These blood tests are very important to keep your place on the waiting list. This is also a good time to review your finances to determine what your deductible and copays will be and how they will be paid while you're in the hospital. You want your care plan to be fine-tuned when that donor liver is found and the call comes.
When I got that call, I was scared, and literally, honestly, I actually told my husband, what about if I give it to the person that's waiting? And he's like, no, he's like, you've came this far. He goes, we can't go back.
As soon as a donor liver is available, you'll get a call with specific instructions. That call could come on a holiday, in the middle of the night, or any time at all. It cannot be scheduled at your convenience. So you need to be ready, especially as your MELD score gets you closer to the top of the transplant list. Know where to go and what route you will take. Also be aware the nurse calling you may be using an unfamiliar number or a blocked caller ID. That could be the call you're waiting for. Answer it! There's a chance you'll be called to the hospital and sent home because the donated liver was not suitable. Or you could be called in as a backup recipient and also sent home without a transplant. Think of these as dry runs, as a dress rehearsal for the real deal. When you are called, you will need to get to Baylor quickly. Once you get to the hospital, your current medical condition will be checked with labs, tests, an EKG, and chest x-ray. You may also be offered the choice to be in a research study. Baylor is involved in many national studies. If you give your consent to be in a study, you may be able to get new investigational medications and treatments before they become generally available. A typical liver transplant operation takes about 4 to 6 hours. As soon as the transplant is done, your surgeon will tell your family how the operation went and how you're doing. After surgery, you'll go straight to the intensive care unit, called ICU for short. You'll wake up slowly in the ICU as the anesthetic leaves your system. You'll be connected to tubes that provide nutrients and medications, help you breathe, and drain fluids from your stomach and bladder. The transplant team will come by once or twice a day to check on your condition and update your family and friends. The average stay in the intensive care unit is 24 to 48 hours. How long you stay in the ICU will depend on your condition before surgery and how quickly you recover after the operation. As soon as your condition allows, you'll be moved to a regular private hospital room on the transplant floor. Your loved ones can visit any time or even spend the night. Your transplant team will check on you routinely to review your progress and medications. The human body heals faster if it's put to work, so our staff will get you up and moving. A Baylor physical therapist will work with you to regain your strength. Your nutrition specialist will help the physician decide when the feeding tubes can come out and help with choosing a well-balanced, protein-rich diet. Your team will include transplant fellows and residents. These doctors are receiving advanced transplant training. The length of stay for a transplant patient at Baylor can range from a few days to a week or more. Besides recovering, one of your most important tasks will be to learn how to care for yourself after you leave the hospital. Before going home, you will learn about the signs of infection and rejection, medications, good nutrition, and general health guidelines. After you are discharged from the hospital, you'll stay under close medical supervision and go to the outpatient liver clinic at least twice a week for up to 6 weeks following surgery. Your body's immune system may try to reject your new liver. It is important to know that rejection is effectively treated with medication, and with early treatment, it's almost always reversible. It is very uncommon for the liver to be destroyed by rejection. You will be on medication for the rest of your life to prevent this. Rejection happens most often within the first 3 months. Because of the risk of rejection, you need to stay within a 50-mile radius of the Dallas-Fort Worth area for about 6 weeks, so your medication can be adjusted as needed. One housing option is Twice Blessed House. Twice Blessed House is an apartment complex close to the hospital that provides a comfortable, affordable home away from home for you and your caregivers. This expense needs to be considered as well when planning for the transplant. Your transplant surgeon will decide when it's appropriate for you to go home, where you'll be under the supervision of your primary care physician. Just like before your transplant, you'll need to have ongoing lab tests. You will need to make sure those test results get to your Baylor post-transplant coordinator. Your transplant team will review your results and give your primary care physician specific medical guidance when needed. Even after you return home, communication between you, your primary care physician, and Baylor is necessary to manage your health. Taking required medications, keeping scheduled follow-up appointments, and guarding against infection and rejection will become part of your lifestyle. And of course, you must take care of your general health too. But these obligations will be balanced by the many pleasant things you can look forward to, like feeling better, going back to work, and returning to everyday life. As you get stronger, you will be free to take part in many of your favorite activities.
If you have a liver transplant, you're going to live a better life and you're going to feel so much better.
We all know it's a stressful situation. We all know that it seems like there is no hope. The message we give is simple. There is hope.
Your decision to move forward with a liver transplant is an important one, and we hope this information has been helpful.